figure picture. All right, so here we have the mouth, the esophagus goes down into the stomach, and then into the intestines and so forth, okay? All right, and then let me make the rest of the person. Here's the person. Okay, and I know that looks terrible, so it'd be nice to me. We have the diaphragm. That's the stomach, actually. So this is the diaphragm. And this is the heart. And this is the lungs here, okay? So just so you get a sense of where that is. Okay, so let's read the definition of hiatal hernia. So hiatal hernia is the regurgitation of acid into the esophagus because the upper stomach herniates upward through the diaphragm. So what happens is now when it says it herniates, it doesn't mean it pushes a hole into it, okay? So what happens, and I don't know why this happens, I don't know kind of the underlying pathology is of it, but for some reason this upper stomach actually herniates up into the diaphragm. And so instead of, normally there's a sphincter right here, okay? So normally there's a sphincter at the top of the stomach right here that closes, and it prevents any acid from regurgitating back up into the esophagus. But because this herniation, right here, herniation means pushing up into it, it pulls that sphincter open and it can't close all the way. So stomach acid regurgitates back up into the esophagus. Okay, so that's hiatal hernia. So if you look right below, it says gastric contents move in the wrong direction at the right rate. Now, this is a pattern of opposites. This is the first time we've done a pattern of opposites. We did a pattern of opposites when we talked about chemical biologic terrorism. That was a pattern of opposites. We're doing another pattern of opposites now. Okay, we've done patterns of opposites when we did overdose and withdrawal, and we're doing another one here. Okay. So hiatal hernia is when that upper stomach herniates up into the diaphragm. It pulls open that sphincter and allows acid to move in the wrong direction at the right rate. So now let's talk about dumping syndrome. Okay, so dumping syndrome is a function of weight loss surgery. So here we have again our esophagus, and this goes down into the stomach and then down here. Okay, and I'm not going to bother to draw everything here because it doesn't matter so much. Just know that that's the diaphragm. Okay, so when someone has weight loss surgery, what they do is they actually end up cutting out, literally cutting out much of their stomach. And a lot of times they would even make it so that it's just a small little hole, like right here. And and so actually this would all just turn into that, and the stomach is just right here. That's weight loss surgery, okay? So they cut all that stomach out, and it's a complication of weight loss surgery because when you have such a small holding area for food, then it leaves that area really fast. So gastric contents move in the right direction. So they're still moving in the right direction, but they're moving at the wrong rate. They can exit. So complication of post-op gastric surgery in which gastric contents dump too quickly into the duodenum because that stomach is so small. There's just not any space to hold it. Okay. Now, signs and symptoms. Let's talk about signs and symptoms of hiatal hernia. Let me make this a little bigger so my printing can be a little bigger. All right, signs and symptoms of hiatal hernia. Signs and symptoms of hiatal hernia are all upper GI when or if the patient lies down after they eat. They're all upper GI if the patient lies down after they eat. Dumping syndrome, the symptoms are all lower GI if they sit up after they eat. Now, this is a gravity issue, right? So hiatal hernia, things regurgitate back up. So if you lay down, it's easier for it to regurgitate up, right? Now, when I say upper GI symptoms, I'm talking about burping, coughing, burning, epigastric burning. Those are upper GI symptoms. That's what I mean. If they lay down after they eat, they can have that. Now, dumping syndrome are lower GI, so they can have abdominal pain, diarrhea. And that's for the rest of their life. After they've had weight loss surgery, dumping syndrome is a risk for the rest of their life because they just have this small place where food can hold. So they can get dumping syndrome for forever. So let's talk about the treatment. All right. So first of all, we have head of the bed. And does it say during and 1 hour after? Okay, I want you to cross off during. Everybody sits up while they're eating. It doesn't matter what their problems are. Everybody sits up. So just cross off eating because we're talking about the head of the bed for an hour after meals. For 1 hour after meals. That's really, and I don't know if I edited that for you guys. I don't think I did. I don't think I did. So head of the bed for 1 hour after the meal. All right, so for hiatal hernia, the head of the bed should be up. And for dumping syndrome, the head of the bed should be down. Okay, fluids. Now, before I tell you about the fluids, I've got to tell you one thing. So it's off script, no blanks for this, but normal fluid intake for 24 hours is between 2,000 and 3,000 mils, 2 to 3 liters in 24 hours. That's what we said. We tell people, how much should I drink? Between 2 and 3 liters a day, 2 to 3,000 mils. Now, there's a phrase we can say restrict fluids. If we tell a person to restrict fluids, that has a quantitative measure. We're not just like, drink less. If we say restrict fluids, we mean less than 2,000 mils a day, usually around 1,500. That's what that means. If you get an order to restrict fluids, they're saying less than 2,000 mils a day. If they give you an order to push fluids, that means more than 3,000 mils a day. Okay, that's what that means. It has meaning to it. We don't just like, drink more. No, like a lot more, like 3,000 more than 3,000 mils a day. That's what those words mean. Restrict fluids, push fluids, okay? So having said that, now that you know the definitions, let's talk about fluids. For hiatal hernia. For hiatal hernia, you want to increase fluids. This does not mean push fluids, okay? So it doesn't mean we're pushing fluids. It doesn't mean that they have to have more than 3,000 a day. What it means is that while they're eating, they should have fluids. So they can still have 2,000 a day. It just means that some of that 2,000 needs to be with their meal. So they eat 2 bites, take a sip. Eat 2 bites, take a sip. Eat 2 bites, take a sip. Because this is fluids with meals, don't forget. This is fluids with meals, not just fluids in general. It's fluids with meals. So increase their fluids with meals. It doesn't mean push fluids, but they need to drink while they're eating. With dumping syndrome, we want to decrease fluids. In fact, they're told no fluids with meals. This does not mean restrict fluids. In fact, they're encouraged to drink as much as they want. They're like, drink all you want, just not with meals. Because if they drink while they eat, it exacerbates dumping syndrome. So they can drink all they want throughout the rest of the day, just not with their meals. No glass on the table for them while they're eating. Okay. Now, carbohydrate content with meals, carbohydrates are considered to be something that exits the stomach faster. So carbohydrate content for hiatal hernia should be increased, and for dumping syndrome should be decreased. So if they ask you which meal would be best for a patient with hiatal hernia, well, pick something that has carbohydrates in it. Don't just do like steak and green beans. Steak and green beans would be great for dumping syndrome. You'd be probably more interested like doing a hamburger with the bun and a baked potato for hiatal hernia, because you want to have some carbs. Okay. Okay. Well, we're about 10 minutes early. Holly, would you talk more about the signs and symptoms of tetralogy of Fallot at the end? No. As I told you everything I know about tetralogy of Fallot. Everything I know is what I told you. The only thing I can tell you is it's trouble. Probably gonna have surgery before they leave, NICU, extended length of stay, go home with home care, have oxygen, right? All that stuff. But I don't know anything more about tetralogy of Fallot than what I told you. Is semi-Fowler's up? Semi-Fowler's is usually about 30 degrees. 30 degrees or less, a little around that. Is there a degree for head of the bed? If we want the head of the bed up, no. I usually say semi-Fowlers, Fowlers, high Fowlers. So there's semi-Fowlers, Fowlers, and high Fowlers. I would probably do Fowlers or high Fowlers. Fowlers or high Fowlers is probably what I would be looking for. Head of the bed equals flat. Head of the bed down equals flat. It could be. Yeah, there's no reason not to have it flat. Yeah, that's fine. Yeah, you got to lay down after dumping syndrome. Prevent it. It's for an hour, not 30 minutes. Could you repeat why we should decrease carbohydrates for dumping syndrome? Carbohydrates exit the stomach faster. So have you heard of the word chyme, C-H-Y-M-E? C-H-Y-M-E. Deanne, ask somebody the table for page 8. I'm going to go back and look for that, honey. I don't know. Okay, I can't just get it right off the top of my head right now. Samuel, could you repeat why? See if somebody can help you with that in the chat. If they can't, then ask me again. Could you repeat why should we decrease carbohydrates? So carbohydrates just exit the stomach faster. Fat and proteins just stay in the stomach longer. It just is what it is. It's just a fact. You stay full longer. That's why if you eat a high carbohydrate meal, you don't stay full as long. You're hungrier sooner. If you eat a high fat diet, you're not hungry again for a while. It just is what it is. Okay, so if you